1.
Hey everyone, this is Dr. Groff from Cosmetic Laser Dermatology here in San Diego, California. And we're going to be injecting 2 products today. One of my favorites, if not my favorite, is Voluma. Voluma is a great product that's hyaluronic acid based, and we're going to inject it into the cheek to give the cheek a little better shape. And if you look at the cheek here, you can see there's this slight break through the cheek or indentation. So we're going to use it to soften that. And then one of the newest products on the market is Vollure. Vollure is an excellent product for patients who want lip augmentation or possibly to soften the nasolabial fold, or what we call the melolabial fold, which is from the corner of the mouth down through the chin area. So we're going to demonstrate that as well. But we're going to start with the Voluma on the cheek. So here we go. So we're going to start on Carrie's right cheek. Can I have some Hibiclens, please? The first thing we do, of course, we put our gloves on, but I'm going to cleanse the skin with some Hibiclens, which is an antibacterial agent. There we go. Now Isabel's going to hand me the Voluma. You can see it's a clear gel, and this is what we'll use to augment Carrie's cheek. Here we go. So I'm injecting some product now to help shape the cheek. You can see how it elevated that portion of her cheek right there almost instantly. You can see a difference. I'm going to go more in the medial cheek this time. She's very deep, so you have to inject quite a bit of product to make a difference. Now it's going to vary patient to patient, but you can already see how that trough is much, much softer. It looks really good. What happens when we get into our 30s and above, there's a fat pad in the cheek here that splits. So it splits in half and falls down and makes this fold look heavier. And then you have a groove for your cheek. You can see that groove is completely gone now in Carrie's case. So I'm going to put a little bit back here just to give her some shape and curve through the cheek. You want a nice, gentle, almost like a C-shaped curve through the cheek. Not too much, but just enough to alter the depression and give a little bit more curve. So that's about perfect. Of course, there's always going to be a little bit of swelling afterwards. You can see there's really no bleeding, or she'll have no bruising from that. So that's Voluma.